Welcome to the Black Entrepreneur Experience podcast, inside the business, buzz, and brilliance of Black entrepreneurs. Here is your host, Dr. Frances Richards.
Innovative Thinkers, episode number 192, Innovative Thinkers.
Thank you for joining us as we elevate the Black entrepreneur experience by interviewing CEOs, thought leaders, innovative thinkers, and Black entrepreneurs across the globe. I'm your host, Dr. Frances Richards, registered nurse for over 40 years and currently works at the Memphis Veterans Affairs Medical Center. Our next guest said, early detection is key, and with these tools, we can achieve a reduction in emotional, physical, and financial costs to the VA, veterans, and their family. And we're talking about diabetes. Welcome, Maria Akpotu.
Good morning.
How are you doing?
I am wonderful, and how are you doing?
I am perfect. Why don't you fill in the gaps? Why don't you share with our audience what you want them to know about you and the work that you're doing at the VA Medical Center?
My name is Maria Akpotu, and like you stated, I've been a nurse for over 40 years, and that comes with quite some experience. And working in the VA Medical Center in Memphis, I came across a lot of diabetes, and I found a need for the population that we serve. Diabetes is a problem, and with it comes a lot of other issues like limb loss. And I noticed limb losses were at an alarming rate. By the CDC, 2%, that is 5 in every 1,000 of the population of the United States, will have their limbs amputated due to complications of diabetes. That rate is even higher with the veteran population. So that got me to thinking, what will be the best thing to do to help them? And that's how I came to finding a solution to the problem that will nip it at the bud. A solution that will help the veterans, put the control in the hands of the veteran so that they become a part of the solution to eradicating or bringing to a very, very low rate of amputation.
And what is the solution that you came up with?
I came up with a handheld mirror. I tag HETELF, HHTELF, and that is the abbreviation I came up with in short. And that is a handheld, expandable, telescopic, flexible, lighted mirror. This mirror expands to up to 3 feet, and because our population have other comorbidities such as obesity, arthritis, and with age, people are less likely to be able to bend over and look at their feet. But I realize what we teach is check your feet, look at your feet every day, but we are not telling the veterans how to do it. So I came up with that initiative to provide them with a mirror, something that can be long enough. And even though they can't bend, they are obese, they can still do that check. They can still use this tool to do the check on their feet. And I have the instrument, the mirror. I can show it, as we progress. So it's a mirror that expands to about 3 feet, such that they can hold it in their hands, sit down, relax, either on the recliner, they can sit on the chair, they can lay down in the bed, pull out this mirror, turn the light on, expand it, and while sitting, still look at their feet. And because it has the light, it has the added advantage of, being able to see, because with diabetes also comes retinopathy, which is the degeneration of the retina in the eye. So this light also helps for the veteran to see. And even if the veteran is still unable to use this mirror, a family member can help pull it out and look at the feet. The goal is to see any change. Those are the key words. Any change. Any change for one person could be different for the other person. Because when we say look for swelling, look for redness, look for infection, it is different for individuals. The person that is light skinned, redness could be different. So it is, the key word is change. Anything that has changed from what your feet looked like previously is a cause for you to seek help. Any change whatsoever. It's better to err on the part of caution than to sit and say, oh, when I go to my doctor. No, any change is a cause for you to seek help. So this mirror enables the veteran to look. You check again, you refer, you get help as soon as you notice a change. So when you look at your feet, you want to be looking for things like swelling, things like redness, which will indicate infection. Apart from that, the diabetics also can feel as much as any other person. So they may have objects in their feet for days, weeks, and don't know they have stepped on a nail, a piece of glass, or anything else for that matter. So when you look and you see something different, that's when you know that, yes, I have stepped on a piece of glass. We've seen people step on glass, nails, and things like that and they've harbored it for years without knowing that anything is going wrong. And by the time they come to the hospital, it is too late to save those limbs. We want to be able to save limbs, prolong limbs, have those limbs working for you for as long as possible. And the last resort will be amputation. That should be the absolute last resort. We want to be able to save those limbs, extend the life of the limbs, and have amputation as the very last resort.
Maria, when we talk about this tool that's going to help veterans that have diabetes, is this available for all veterans nationwide? We know that you're in Memphis, or is it just a select area that has these tools available?
The goal is to have it to all veterans worldwide. The beauty of this piece of instrument is that it has gotten the attention of the VA worldwide through the help of VA Memphis. Did have a visual presentation during the Nurses Week. And during this presentation, it was captured, virtually. Our VA Memphis Public Relations Department, they were there. And the head of this department, Mr. Willie Logan, and the videographer, Mr. Romeo, they all took a lot of interest and felt that it is something that the whole VA, and in fact, the whole world will benefit from. I also had my director of nursing, Dr. Malik, at the presentation, and she was so excited about the tool that took the one I had and said, give me a minute, I'm so excited about this, let me do something. And she purchased 12 pieces of this mirror and gave me a charge. I want you to get this out to every corner of the VA. Get the word out. She was so encouraging. And so with the help of Dr. Malik and the communications department, Ms. Logan and Mr. Romeo, this word went out. Miss Willie Logan posted it in the internet, and the local VA and everybody went like, oh my God. It went all the way to Washington, D.C. They reached out to me to answer some questions that patients were asking and wanting answers to. And the patients were very, very happy about it. And so I responded to those messages with some pictures from what was requested from Washington, D.C. as to what will the patients be looking at when I say infection, when I say swelling. Some of us, and in fact, most people will relate when they see what you're asking them to do. So I provided those pictures with consent, of course, from the veterans, and that was sent and uploaded to the VA podcast, which is the Vintage. This information was also posted on the VA website on their Facebook. So right now, the information is on the internet, is in the intranet, the podcast, which is the Vintage, as well as the VA Facebook page. So what I'm doing now is making sure that veterans are educated, that the staff are educated, and I'm trying to get the doctors on board because they will be ordering these instruments. The hurdle I'm trying to cross is knowing who is going to be ordering this equipment so that it is available. Because the veterans that I have talked to during my research, they were so excited, and some questions they asked was, will I get this one when I'm going home? Will my doctor order it for me? Some wanted to know where can they buy it for themselves. So it is a piece of instrument that will really help, will really help our veterans to be a part of the solution. We're putting power in the hands of the veteran. We're giving them the tool and the skill and the knowledge to take the outcome of their health in their own hands. And they are very excited about it. The word that says knowledge is power, so they feel empowered when they know that something as simple as this will help them. I've also had testimonies, even colleagues. I had one that was in tears, and she said, where were you when my mother had her foot amputated? This would have helped her to see that she had some wound in her foot before it got bad. Things like that, I have had testimonies of how wonderful this is going to be helpful to our population.
We'd love to know what you think. Feel free to drop us an email at fr@francisrichards.com. That's fr@francisrichards.com.
So, Maria, someone's listening and they are a veteran. And so they're saying, how can I get this tool? And I want you to share the name of it so they'll know how to get it from their doctor. Tell them what they need to do.
Well, then, when they go to their doctor, they need to be asking for a handheld, flexible, telescopic, expandable, lighted mirror. It is a mirror for checking their foot. So it's a foot mirror. It's expandable. I'll show it to you. This is the piece of equipment. It is so compact that you can further fold it up and put it in your pocket, and you can expand it. It has the light at the very end. It's just a switch. You turn it on, and it expands to about 3 feet. So while I'm sitting on a recliner, I can turn this to whatever direction I want and take a look at my feet. So it's a good instrument that is easy to use. It's lighted for that extra lighting, and it's expandable. It collapses back very easily, and you can turn the light back out. So it's an expandable mirror, and the goal is to have it in all the VAs, starting with the VA Memphis, and occupational therapy can also provide it to the patients because there are other instruments that the VA provides to the veterans. So it can be stored with the occupational therapy, it can be stored with physical therapy, or in the central supply. It just depends on what the Memphis VA come up with as to where these instruments will be stored and who is going to be purchasing it for the use of the veteran. So that piece of equipment.
Ms. Maria, talk to our audience about diabetes. And so let's say a person is listening to this podcast and they're saying, my doctor told me that I'm borderline diabetic, or talk about how important it is for them to start to take care of themselves even before pre-diabetes. Talk about diabetes and what we need to know about that.
Diabetes is a situation where the individual's body is not able to break down the sugar, the rate at which the sugar is being produced, and the rate at which the insulin is being produced does not match. That is in simple terms. So the insulin is not able to break it down as quickly as the sugar gets in the body. Now, for every normal person, the amount of sugar you take determines how much insulin is produced to digest that amount of sugar. However, certain things could happen in the body, creates a dysfunction. So your sugar gets so high in your body and it could cause all kinds of problems. Now, what we know as a people is they tell you to lose weight and they tell you to do exercise. That's mostly what we have grown to know about diabetes. When you lose weight and you exercise, you're going to do better. And that goes for almost every disease condition. They want you to lose weight and then exercise. However, apart from losing weight, getting on a diabetic diet, and exercising and taking your insulin, or whichever, depending on the form, some do injectables, some have to do oral pills. You also have to check yourself. You have to check your feet. Remember, your feet carries the weight of your body, the weight of your body. And when we lose a limb, even a toe, it wears on the individual psychologically, emotionally, physically, even spiritually. So protecting the feet from being amputated seems to be an additional part apart from your diet, apart from your exercise. You need to protect your feet. A foot that is checked is a foot that is saved. We want to avoid amputation, and we want our veterans to know what we're teaching, or anybody else that has diabetes. Checking your feet is like brushing your teeth. It's a daily activity. It becomes, you have to make checking your feet a part of your daily routine. When you take your bath in the morning or in the evening, however you do, if you don't even take a bath, be sure that just the way you're brushing your teeth, whatever you do on a daily basis, that you add foot, your checking of your feet as part of that activity. So when we check our feet, the goal is to detect early any change. And then you need to be talking with your doctor or your practitioner. It could be a family nurse practitioner, whomever you're seeing that is taking care of your feet. It could be your pediatric doctor. It could be your primary care doctor. That individual, that practitioner needs to know that you notice a change in your feet. Another thing I have to tell diabetics worldwide, do not clip your nails. On no account should someone who has diabetes clip their nails. Do not cut it with a clipper, a scissors, a razor blade. Any of those things should not ever come to your nails. The reason being that you won't even know if you have cut yourself. You will not know if you have an infection going on, except when you look. So the best suggestion would be to file the nails. Use a file to file. If you file once or twice a week, that will be a good idea. In between your pediatric visit, in between your primary care visit, you need to do that. I've had people say, oh, I couldn't go to my pediatric because of the lockdown. Oh, I couldn't go to my doctor because of the lockdown. They have toenails that have clawed over like half an inch long, digging into their skin. That is not a good excuse. In between your doctor's visit, you as a diabetic should be taking care of yourself. So checking your feet is what you need to do in between visits. And you can file your nails by yourself. If you're not able to bend over, get a family member, get a friend, get somebody to file those nails for you. Do not allow your nails to grow over such that they become claws. That's not good for a diabetic because it's going to dig into your nails and you're going to have infection. And some also have very tight stockings. That is going to further constrict the blood supply that is already in short supply to your extremities. So you have to put on loose shoes, loose stockings. They have diabetic stockings in the stores that you can use, and make sure you change it all the time. Another thing that a diabetic can do is to wash their feet. Again, that's a daily activity. So when you wash your feet, you inspect it at the same time. Dry in between the toes. Those areas could harbor bacteria. So it should be dried in between the toes. And when you put your cream, do not put it in between the toes. Again, you don't want anything logging there that is going to cause moisture and infection. So those are some of the things a diabetic can do to protect themselves.
Tell us, Marie, what are you most grateful for right now?
Right now, I'm just very grateful that I'm alive and healthy. So I'm grateful for that. I'm also grateful for my family, my children, and grateful for my job that God has given me the vision to come up with this solution for the veterans. I'm grateful for a lot of things.
What is something that we as consumers we don't know about diabetes that we should know?
What I think is it does not matter the disease condition. As consumers, we need to know that we got power. We got power as human beings to be able to control some of the things that is handed on to us in the name of diagnosis, because our environment, the food we eat, our lifestyle are things we can control. God has put things in the environment to help us. All we have to do is do them or consume them in moderation. So if, for example, somebody is told you have diabetes, learn as much as you can about the disease condition and do that. You got the will to change the course. Sometimes people say, oh, it's so hard. I like this food and I like the other food. What you need to remember is before you started eating those food, you were eating something before that. Whatever we're consuming that is hurting us, we have the power to be able to change it. We have the power to do little things for ourselves rather than waiting for the doctor to do everything for you, waiting for the nurse to do everything for you. You as a person have the power to control the outcome of your disease condition. So, for example, when we say check your feet, you can do that on a daily basis. As far as you can eat on a daily basis, you should be able to check your feet, should be able to take that walk, should be able to eat in moderation. The sugars hurting us. We really have our food tasting the way it should be. God has put everything in the food like it should. But we as human beings, we want to add more sugar. We want to add more salt. We want to add some more sodas. And things like that are what is hurting us. When we can cut back on those added things, you begin to enjoy food as it should be. We begin to enjoy food as God has made it to be. And, do it, a few more things that are not artificial, no added preservatives, things like that. We may say, oh, they are so expensive. No, when you look at what you have to spend to treat the disease, you might as well put it in those quality food. And then you don't have to spend the extra money on curing a disease or eliminating the symptoms of it, because that's what medicine, most drugs do for you. It relieves the symptom and creates some more new symptoms. At the end of the day, you have a shelf full of medicine. one medicine creates another and another and another. But if we can get life under control, little bit at a time, it's not easy. Habits are hard to change, but the fact is you have the control. You do one thing at a time. You're taking a bottle of soda, for example, you may start doing half a bottle, and gradually you may be able to mix it up with water, and eventually you may start drinking water. So it's always a work in progress. I encourage everyone that has a diabetic challenge, you can do it. You just have to start with baby steps.
We'd love to know what you think. Feel free to drop us an email at fr@francisrichards.com. That's fr@francisrichards.com.
Can you reverse diabetes?
Yes, you can, depending again on what type of diabetes that you have. Some are called juvenile diabetes that start real early at birth or very young age. Some are acquired, like most of the type 2 diabetes, So you find that when you change your diet, when you lose some weight, when you start to exercise, you may turn out to be no more diabetic. Like when they tell you you're pre-diabetic, for example, that means you're going down the road to becoming a diabetic. So when you start to reverse those extra sugars that you're taking in your diet, lose some weight, you find that by the time you go back to your doctor, they say, oh, your A1C is good. Your numbers are looking good. That's just what it is. Yes, some diabetes you can change. I share a story. I used to have a colleague in a facility I work, and I noticed with this gentleman that it didn't matter what potluck we did. It didn't matter what food we brought. We did potluck once in a while. He will never eat. But he may, if he likes the food, he may fix himself a plate and just hold it. So I got curious and I asked him, I'm like, why is it that I've noticed you don't eat? When do you eat? What is it that you don't like the food? He's laughed and he said, I used to be almost 400 pounds. I said, okay. He said, my family, we are 8. My dad died of diabetes. My mother died of diabetes. And my siblings all are diabetic. He said, I made a choice that I was not going to go the same way. So he said, my diet is very simple. He said he does eggs and 2 slices of bread in the morning. He does a salad in the afternoon, and he eats a little piece of baked potato and some meat for dinner. I'm like, wow. And that he does not eat after 8 p.m. So by the time he's at work, his eating window has expired. And so that's why he doesn't eat. And he is not diabetic. He does not have hypertension. He does not even drink water after 8 p.m. That is how strict he is with his routine. And so, yes, it can be reversed. It's not a death sentence. We can change the course of even the family history. Even if you're not able to reverse it completely, you may be able to reduce the effect that it has on your body.
Maria, we want to thank you for being a nurse and just serving the veterans, those that have served our country. We are so grateful to them. And so we want to shout out to all nurses and veterans and doctors and everyone that is frontline all the time. So we want to talk to you about COVID-19, being a nurse, working at the Veteran Hospital. What advice would you give people in terms of what you're seeing with COVID-19, if you can talk to that?
Yes, I can. I want to join in thanking, especially the Memphis VA Medical Center that I'm a part of since the pandemic hit. This Memphis VA has been on top of it. Even when people did not have masks, we were encouraged to use ours. until the masks were available, and it has been distributed to every worker. And since this pandemic, in the Memphis VA, you cannot come into the VA medical center without putting a mask on. Even while walking the hallways, while transporting our patients, nurses, patients, everybody has a face covering. That is something that I really appreciate about the Memphis VA. From the chief executive to the least, everybody has a face covering. That also, we have been following the CDC guideline very closely, and every update is communicated in a timely manner through the communications department. It is communicated immediately to everybody. We do talk about it during huddle among nurses, during stand-up meetings that we have with all the heads and the various departments. So it is something that we take seriously. Now, with the patient population, visitors are limited, except there is a dire emergency. So maybe somebody on the palliative care and undergoing surgery. You have to have a really specific reason to be allowed to visit. Most times we talk with our patient's family on Skype and on the phone. So that has added an increased responsibility for nurses and doctors, but everyone has risen to the need to talk with family. They call multiple times in a day, but that is something we have to do because they're not able to be at the bedside like they used to. And before COVID, the veteran hospital did not have any limit as to visiting time. They could stay anytime they please, stay at the bedside. But now visiting time is limited to 8 p.m. And then at 8 p.m., the visitors have to leave. And this just started this week. So that is how liberal we have been. But in terms of protecting the workers and protecting the veterans, this Memphis VA has been on top of it. They have done everything that's necessary to protect the workers. And screening is also ongoing in this Memphis VA. We screen the patients before they come into the building, and the staff is screened every day before you come into the building. We do temperatures, and where there is a positive screen, they go further to do the swab.
Thank you for sharing that. Maria, tell us, what was your first job before you became a nurse?
My very first job, I was a teacher straight out of high school. I taught for a few months and then got admitted to the university to study nursing. And then I finished nursing, and I've studied all kinds of things and have all kinds of degrees.
Share with our audience your degrees.
I'm a registered nurse, I'm a registered midwife. I have a master's in law, I have a law degree, I have a social work degree. It's like I've been in school forever. I am also a certified ophthalmic nurse. I have a license as an accident and emergency nurse.
Thank you for that. What is some advice you wish you had followed?
Some advice that I wish I had followed is sticking with following my mind, doing what I want to do and not what somebody else want me to do. So, for example, I wanted to be a broadcaster. That was my passion, talking to people. But my dad is like, no, you're not going to go on television. But in a way, I still find myself doing that, having to talk to people, whether it's being a lecturer in church or being a teacher at the university where I taught for some years, taught accident and emergency nursing, or, talking to people as CNA instructor when I had my CNA school, or doing hands-off, or just doing what I'm doing now. I still am communicating to people. So that's something I love to do, is share knowledge and impact people as a whole, through little knowledge that I have, and it could be a big thing for somebody else. So I like to communicate and share knowledge.
What are three truths that you've learned so far in life that you want to share?
One is follow your mind. If you believe in something, you follow your mind. That doesn't mean you don't listen to others. You're going to listen. And in listening, you may be able to sharpen that resolve that you have. Listening to people is another thing. It is important because you learn when you listen. You have to be able to listen. If you can't listen, you can share because your knowledge may be incomplete. So, listening to other people's point of view and trying to put yourself in their position gives you the added advantage of even improving on your knowledge. So, you follow what you think is right, ever you want to listen to others so that in your resolve, it is even sharper. It is even more crisp in terms of what you have resolved to do because you've listened. Another thing that I have learned is to share. I like to share knowledge. And sometimes I tell myself, but they didn't ask me. But my inner mind tells me when I'm listening or I see a problem and I think I have a better solution or I have any idea that I think could help somebody else, I do that. It's something that I grow in life and it's like a promise I made to God through all my trials and tribulations. I came to resolve that doing it my own way may not be the best. I have to listen to my inner spirit and help somebody else. So people may be in a conversation and I hear something, I could say, listen, I know you weren't talking to me, but this is what I think. I like to share. If I think something will benefit somebody else, I don't hesitate to put that information out. I don't want people to go the hard way. If I have experienced something and figured it out, I'm going to share. That's a promise I made to my God, is to share whatever has benefited me. I don't like to see somebody else struggle or just be in pain when I have a solution. It's hard for me to keep that to myself. So those are the things I've learned in life. Sometimes I get pushback, but I would say 99% of the time, even if they get upset that they weren't talking to me, it's not my business or something like that, I find them coming back to say, you know what? Thank you for telling me that. Thank you for, I thought about it and it was the best. So I just thank God when that happens. I feel good that I am following what I think God wants me to do.
Maria, if you conducted this interview, what is the one question you would have asked yourself? I want you to ask the question and answer it.
Is there a way I could have had this interview done like in person? Because when you do stuff in person, I mean, this is great given the COVID-19, but in person, it's just something different. When you do stuff in person, it sheds so much light that you cannot find when you're communicating either on the phone or doing the way we're doing it now. But I know we're doing the best we can given this situation. But I would love to have an in-person interview.
Thank you for that. And we hope to have that soon. So we've come to the part of our interview. It's called Fun Facts Lightning Round. And I'm going to ask you a series of questions. And I want you to answer the questions. If there's something you desire not to answer, feel free to say pass. Are you ready for the Fun Facts Lightning Round?
Yes.
The last movie you saw?
When they see us?
You relax doing what?
Walking.
Your favorite singer or rapper?
Beyonce. No, she's a rapper, but that's my favorite singer.
Your favorite dance song?
It's reggae. Anything but Mali. I'll dance to.
What food you eat every week, no matter what?
Tea every day.
Your favorite month?
May, that's my birth month.
Thank you.
It's my favorite month.
Maria, we want to thank you for being an innovative thinker guest for Black Entrepreneur Experience podcast. Before we let you go, why don't you share with our audience the best way that they can reach you and give another shout out to the wonderful place where you work, the VA hospital in Memphis. And if anyone is interested in connecting with the VA hospitals, the best way that they can do that.
I know that the VA is on the web, it's on the internet. This information is on Vantage, and it's also on the VA Facebook. So every veteran, everyone out there, shout out to the VA Medical Center Memphis. They are great innovators. It's a wonderful place to work, and I am so grateful to God and happy to be a part of the Memphis VA Medical Center.
Thank you. That's a wrap.
Thank you. Have a great day.
Thank you.
Thank you for listening and subscribing to Black Entrepreneur Experience. We would love for you to leave a review and rating on iTunes and share with your friends. For show notes and more episodes, go to www.beepodcast.com. Join us next Wednesday, and remember, green is the new black. So keep your bank accounts and your business in the black.